from where the Senate left off back in the fall after Senator McConnell and his effort in the summer failed. There was an effort to try to revive a repeal and replacement of Obamacare, led at that time by Senators Graham and Senator Cassidy. I worked very closely with them, along with Senator Johnson and Senator Heller, in trying to do a different approach, an approach that was modeled after the last big successful entitlement reform that Republicans put forward, which was in 1996, which was welfare reform. And in that bill, as in the what was called Graham-Cassidy, was an attempt to take the money that was being spent at the federal level through the Affordable Care Act, repeal all that money being spent on tax credits and on expansion of Medicaid. Most of the money was spent on expansion of Medicaid, and take that money in a block grant and send it to the states, and then give the states and the governors and the legislatures the flexibility to design their own plan. That plan came close. But ultimately, because of the very short time frame, we had only till September 30th. That effort came up short. There was again, tip my hat to the Heritage Foundation and the Galen Institute, Grace Marie Turner there, and others. Really decided, hey, we're not going to stop at this. We still have an obligation to work together to find a solution to this disastrous Obamacare. And so I joined forces with those organizations, brought in, I would make the argument, really a blue ribbon group of conservative, free market oriented scholars throughout and around Washington and growing to around the country. We brought in state-based think tanks, other for-profit folks who were in the private sector who could give us some perspective. And over the last 4.5 months, we have been meeting every Wednesday, going through and trying to take the skeleton, if you will, of what we believe could be effective reform, which is getting the money out of Washington, getting that money on a budget. Right now it's an open-ended entitlement, putting it on a budget, capping the amount of money that we're going to spend, and giving the money out to the states and giving them some flexibility to be able to design a system that's going to work better for the people who are in the individual and small group market, which is what Obamacare was focused on. So that effort has been ongoing now for, like I said, for the better part of 4 months. And we are reaching consensus. And that's really the exciting first bit of news that I will share with you, is that working closely now we've expanded the group. The White House has been involved. Vice President's office has been very, very deeply involved in this process. And now increasingly members of the Senate staff, some of the key leaders in the Senate on this issue have been engaged, and we are making solid progress. And here's just an overall framework of what this bill is going to look like. And then I'll turn it over to Dan, and he can explain sort of where the politics and the policy are now potentially merging together when it looked sort of like all was lost a few weeks ago. So we have, again, kept the basis of Graham-Cassidy, but really most of Graham-Cassidy has been pushed aside, other than the framework of block granting this money to the states. And we've taken a little bit of a different approach. And the approach is, yes, we're going to block grant this money to the states. But one of the things we found out with welfare reform was that many of the states, if you gave them complete flexibility to do whatever they want, wouldn't do things that were actually good policy. And so what we are doing is the way we describe, we're putting some guide rails on how this money can be spent. And the most important guide rail is that the vast majority of this money has to be spent in the private marketplace. This money is going to go out to the states, but the states have to spend this money by and large to construct a marketplace that's going to give individuals and small businesses the opportunity to buy affordable insurance that match the needs of the individual or the small group market. There'll be choices, there'll be affordable options, and that is going to be the real emphasis of this money going back, instead of what is the current state of play, which is a big dramatic expansion of government through the Medicaid program. So it's a fundamental shift. Number two, that a portion of the money has to be spent to lower premiums for everybody. As you know, Obamacare puts a bunch of people in Medicaid and subsidizes lower income people who are between 100 and 300% of poverty, gives them very substantial subsidies. Why? Because the premiums are ridiculously high. The deductibles are ridiculously high. They've been the marketplace is collapsing with Obamacare, so the government's just throwing more money in. And what we're saying is, no, we want to use some of that money not just to provide support for low-income people, but to work and do what we call risk mitigation or other things to lower premiums for everybody, whether you get a subsidy or not. We're going to make the states look at how they can create an insurance market that brings down premiums for everybody, whether you're subsidized or not. So those are the two key and the very, very big changes to the bill. The third thing is we want to make sure every individual has a choice. If this money is going, again, to the small group and to the individual market, that every individual in that marketplace will have at least two choices to be able to pick the insurance policies they want. And so we're saying that if the state, let's take a state, let's say, for example, Connecticut, they may take some of this money because we do provide flexibility, and they say, you know what, we're going to create a government program for the very low income in this group and create a Medicaid-like program. Well, they have the flexibility to take some of the money and do that if they want to do it. We don't think it's fair for the individuals in Connecticut who get stuck in that program to have only one option. So what we say is that if Connecticut does create a program like this, then the individual that gets put in this program by the state has the option of taking the cash equivalent money, benefit, taking that as a cash subsidy, and going out into the private marketplace and buying a private insurance policy of their choosing. So the bottom line is, under this plan, the money goes out to the states, but the individual has a choice in every situation. No one's going to be forced into a policy that they don't want, and that is the key to control and choice and affordability. So that's the big fundamental change that has occurred. We have other things that we're doing. I'll give you one other big one, which is health savings accounts. We've been working very closely with the White House on this, and we are going to do a dramatic expansion of health savings accounts. We're still working on the details, but let me just suffice it to say that we believe that the policies that we're going to put forward in this new bill, which we call we're still working on the name, but right now the working title is the Patient Freedom and Choice Act. But the idea here is to within 3 years to double the number of people who have health savings accounts, and do it without a very substantial cost to the Treasury. So another big change to get individuals more in charge of their health insurance, giving them more control, more choice, more flexibility will be a big part of this bill. The final couple of things that I'll add is to make sure that there is an insurance market. This is something that Senator Cruz and Senator Lee worked very hard on. We are working very closely with them and with the White House on this to make sure that there is going to be a marketplace out there that's going to give consumers the choice to be able to design the plan they want, not be governed by the rules of Obamacare. So having a second risk pool, or that's the vernacular, but it's really an opportunity to have choices in the marketplace to be able to give individuals the ability to pick the plan that they want. So those are all big changes from what was considered Graham-Cassidy back in the fall. All have been worked through and thought through by the community here, and we are beginning to develop a consensus. We've been bringing in more and more groups. This is another effort to broaden the scope of folks who are knowledgeable of this bill and working on it.